Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. Today we'll be talking about acute otitis media. Acute otitis media is an infection of the middle ear. It is more common in children, usually because the middle ear is shorter in children, is more horizontal, and this makes it more prone to obstruction from various causes. It can usually be viral or it can be bacterial. The viral infections are usually self-limiting, but they can lead to secondary bacterial infection. When it leads to secondary bacterial infection, the common bacteria is usually Streptococcus pneumonia or Haemophilus influenza or Mycoplasma catarrhalis. So sometimes you may have a perforation of the middle ear, the tympanic membrane, leading to pus discharge, a condition which is called otoli in medical terms. And some of the presentations include fever. You can have ear pain, irritability of the child, inability to feed, upper respiratory tract infection presenting with cough, and you can also have hearing loss. The diagnosis is usually made from the presenting symptoms and also observation of the tympanic membrane, which will usually be reddened when you look with an otoscope, and it could also be bulging, especially when there is an effusion of pus behind the tympanic membrane, and also an increase in blood vessels in the tympanic membrane. If there is a perforation, then you may find pus discharging from the ear. Management is usually for the first 24 hours is mainly observation with control of pain with analgesics like paracetamol or NSAIDs like Brufen. If after 48 hours the pain still persists and the fever is there, then there is need for antibiotics, usually amoxicillin. And then after that there will be effusion. You can have effusion with the accumulation of fluid behind the tympanic membrane, and this can persist for about a month, but it will dissolve on its own. Some of the complications of acute otitis media include you can have perforation of the tympanic membrane. You can have recurrent otitis media due to accumulation of fluid in the eustachian tube, which is part of the middle ear, and you can also have extension of the infection either to the brain with the formation of pus, and you can also have hearing loss. So in summary, otitis media, acute otitis media, is a common infection in children which can be viral or bacterial. Initial management is usually with the observation, with the pain management, but if there is a persistence of fever, then after 24 hours there is an indication for an antibiotic. So Wellness Health Services, we are located at Katoloni in Machakos town, behind the primary school. We have various services including dental services, where we offer various dental services like dental filling, tooth extraction, and various dental services. We usually have free dental services on Mondays, so for any dental checkups on Monday it is usually free. So welcome to our dental services for free checkups on Monday or any other day if you have any dental issue that you need assistance. Thank you for listening.